The MAN TV.
Subscribe to my channel for latest videos. Osteogenesis imperfecta. Osteogenesis imperfecta is a genetic or heritable disease in which bones fracture, break easily, often with no obvious cause or minimal injury. OI is also known as brittle bone disease. Symptoms include bone deformity and pain, bruising easily, difficulty breathing, hearing loss, loose joints, muscle weakness, curved spine, small stature, triangular face shape, weak, brittle or discolored teeth, blue sclerae, bluish color of the whites of the eyes. Causes. Osteogenesis imperfecta occurs due to a gene mutation change. This mutation may be sporadic, random, or a baby may inherit the gene from one or both parents. As a result of the gene mutation, the body may not make enough collagen. In this disease problem with making connective tissue due to a lack of type 1 collagen. Some parents are carriers for the gene that causes OI. Being a carrier means you don't have the disease yourself but can pass it down to your child. Test. Healthcare providers may use blood tests to check for gene mutations that indicate brittle bone disease. Bone density tests, using low-dose X-rays across the body to measure mineral levels in bones. Treatment. Occupational therapy. It addresses fine motor skills, such as buttoning your shirt or tying your shoes. Physical therapy. Physical therapists prescribe exercises that increase strength, flexibility and range of motion. Assistive devices. Aids such as walkers, canes or crutches can improve mobility. Oral and dental care. It can lead to tooth chipping, color changes or decay. People with the condition need regular dental checkups. Medications. Depending on your symptoms, your provider may prescribe medicines that slow bone loss or treat pain. Subscribe to my channel for latest videos.